fast. Now to another man who's had a major impact on his community. He's a mainstay in the emergency room at Mercy Hospital, visiting with those who need mental health care, particularly the homeless.
But he's not a doctor. New at 5, CBS 13's Kelly Ryan shows us this man's mission to help others navigate to good health.
Bill Shaner walks these halls, helping the homeless with mental health issues. It's a job he says he truly understands because he's lived it.
I decided that I didn't have a disability anymore, that I had an ability, and that ability would be working with people of like kind.
Bill Shaner holds a unique position as triage navigator at Mercy General Hospital.
Mainly, I just talk to the client, get as much information I can out of them, and listen to it as much as I can.
The clients he's talking about are those suffering from mental illness, often homeless.
I can give them hope because I've been through it.
Diagnosed with schizophrenia a number of years ago, Bill was homeless, an addict.
My episode was paranoia. I thought people were scheming on me.
Lots of psychological problems.
Hired as a navigator, he's one of the first people many patients dealing with a mental health crisis talk to.
Sometimes I can just tell, that a person is what's happening before, and then I just let them explain it to me.
It's a knack invaluable to clinical social worker Bryn Jones.
So Bill definitely is able to connect with patients in a way that I can't. He can just relate with them, and there's a lot of times where patients refuse to talk to me.
The Navigator program began 3 years ago, a partnership between TLCS, a community-based mental health agency, and the county with funding from a grant, a program those involved say is already a success.
Recidivism over the last year has been reduced by 62%.
Fewer return visits to the ER. After talking to Bill, the clients are directly connected to services they might need for the next 60 to 90 days. Bill says he's grateful he can share his experience with others.
I try to give them hope, that you're here now, but there's better things that can happen for you.
Making a difference. The funding for this program is up next year.
Organizers hope it gets funded again so it can continue its track record of success.